Welcome back. I'm Dr. Farber.
I'm Dr. Shah. Today we're going to talk about breast revision. A breast revision is basically any surgery done on the breast that has previously had an operation. It doesn't matter if it's a breast augmentation, a lift, a reduction, or even a little adjustment of a nipple or something like that. It is a revision if we are doing a secondary surgery. So the first time you get a surgery, it's called a primary surgery. This is a secondary surgery if we do something else. So the importance of knowing that something is a breast revision surgery is that it is more complex than doing something the first time, because the blood flow to the breast has changed, you have changed, and there is scar tissue that's in that area. So somebody who's had a breast augmentation when they were 20 years old and now they're 40 years old and wants the breast to be more lifted, the implants to be in a different position, that is definitely a different operation than when they were 20 years old.
So who's a good candidate for breast revision? So number one, we want you to be in good health. We don't a non-smoker. We want you to have regular breast exams and make sure that that you don't have any lumps that may be an issue, that you have a recent mammogram if you're over 40, which is the current recommendation. And we'd also like to see your previous operative notes. Not every patient has their information. Maybe you still have your implant card, so we know what kind of implants may be in there. But we'd love to see, if you do have it, your previous operation notes from maybe your previous surgeon, whether it was 7 years ago or 10 years ago. Some surgeons may not have that, but if you do, that would be great. And that would give us a lot of helpful information to figure out how we can best help you and give you the best possible results. So another thing, like Dr. Shah mentioned, is that things change as you age. Your breast when you're 20 years old is not the same as when you're 40 years old. Even if you don't have children, the composition of your breast changes. It's more glandular when you're younger and more fatty when you're older. The skin gets more lax and loose. So we want you to have realistic expectations. The procedure that you may have gotten when you're 20 is not going to be the same thing that you get when you're 40 or 50 or whatever it may be. So, consulting with myself or Dr. Shah will help guide you to give you the best possible results.
There are a lot of different types of revisions, and it's too much for us to just discuss in one video. So I'll give you a basic idea of the scope of what a breast revision is. So if you've had a breast augmentation in the past and you want to remove your implants and replace them, but then the scar tissue around the implant is good, the placement is good, you're just removing it and then putting a new implant in, that's probably the easiest of the operations. Additionally, you could have implants that were in place and you want to remove them and not have any implants replaced. And with that one, the important thing is to know how big the implant was before and what to expect afterwards, because you will have a more deflated appearance afterwards. Once we go beyond that, it starts getting more complex. So we can deal with issues such as the implant is in place, but the skin is stretched, so the breasts look like they're drooping again. There may be displacement of the implant. Something that's common is for the implant to move to the side of the chest, so it's more under the arm than you would like, and rather than being on the chest. There may be some asymmetry. You can have capsular contracture. This is a complication when there's abnormal scar tissue around the implant, and the implant becomes displaced, it becomes hard, and in some people it even becomes painful, and we have to remove the scar tissue around that area, and then also change out the implant. The implants could be ruptured. For a saline implant, if it ruptures, it becomes deflated, and it's quite obvious that it's ruptured. For a saline implant, a silicone implant, it may be less obvious, and you may notice changes in the breast, or it may be found on imaging. And one of the operations, the revisions that we do the most often in our practice here, is a remove and replace of an implant plus do a lift at the same time. So this is typically for a patient who has had a breast augmentation back in their early 20s, and then now they're in their mid 40s, and just because of over time, pregnancy, breastfeeding, whatever is going on in life, the breasts have started to droop. So then we bring everything back, and we're able to do this in one procedure.
So, commonly asked question after every procedure, specifically breast, is what's recovery like? So, recovery after a breast revision procedure typically is a little bit more involved than your primary breast. So if you got a breast augmentation Most of you know that is relatively quick and easy recovery, and some of you may have experienced pain. But breast revision surgery typically involves more surgery, more dissection, more work. So you may be in more pain than your primary surgery. So if we have to remove scar tissue, like Dr. Shah was talking about, in a capsular contracture, or if you have to tighten the pocket so the breasts aren't moving out laterally, that involves suturing, sometimes suturing to the ribs, which can be slightly painful. We have to make sure that you understand that the revision surgery typically is more involved than your primary surgery. So your recovery may be a little bit more involved and a little bit more painful. And of course, we want to make sure that it's as comfortable as possible. We give you the appropriate amount of pain medications and inject numbing medication into your breast, during the surgery itself. So we want to make it as comfortable as possible, but we want your expectations to be that it's probably going to be a little bit more involved than your primary breast surgery.
So first of all, it would be nice to never have to revise any breast surgery, but the first step is, if you're having a primary breast surgery, talk to your surgeon about what to expect over time. Implants are not considered a lifetime device. Some people are able to keep it for their entire life, but we usually tell patients, expect that you may need to do something with them at some point in your life. The other thing is, talk to your surgeon about what we expect it to look like in 10 years, in 15 years, 20 years, whatever. And we can give you an expectation, because each procedure that we're doing in the primary setting has a different way of aging with the body, and it has to fit with what you want. The other part that's really important about breast revision surgery is that you go to a surgeon that actually does revision surgery on a regular basis. I think there are more surgeons that do primary surgeries, like they'll do a ton of breast augmentations, but they don't actually do revision surgeries because they are more difficult. There are a lot of different techniques that you need to know how to do. Typically, board-certified plastic surgeons are the ones who have the training to do this, not cosmetic surgeons. And it's because we also do reconstruction. Reconstruction after cancer, it can be very complex, and we have to do a lot of procedures that's already dealing with tissue that has changed and abnormal or compromised blood flow. So we know all the little tricks in order to get through these difficult situations. So revision surgery, if you have to get a secondary surgery, you don't want there to be a third or fourth. So if you do need something to be adjusted, make sure you go to somebody who has a lot of experience in doing it.
And typically, like you said, that's a board-certified plastic surgeon.
Yes.
We hope you enjoyed the video on breast revisions. Stay tuned for the next one.
Yes, we'll see you soon.
See you soon.